Welcome back to our pregnancy series on All Round Health Talk with your girl, Dr. Onyinye. Well, as you know, this is a channel where our health is a priority. Before we continue with our pregnancy series today, go ahead and hit the subscribe button, put on your notification so you get notified for every single time I post a new video. Today, we're going to be talking about the first trimester of pregnancy. What to expect when you're expecting. We need to know what happens in the first trimester, what will happen to our bodies as women, what will happen within us, and what the doctors would want to do within that first trimester. The first trimester starts from the first day of your last period all the way to 13 weeks and 6 days. That is the duration of your first trimester. Now, the first trimester is a very delicate period of pregnancy, and most women tend to keep their pregnancy a secret within that period because it's a time where there's high risk of miscarriages and spontaneous abortions, and so people prefer to just seek more information and do what they have to do until they are out of the woods. Now, what are the crucial parts of the first trimester of pregnancy? What are you going to notice as a woman? Number one is bleeding. Now, 25% of pregnant women will bleed in their first trimester. This bleeding is very light. It's more like spotting, which can tell us that your fertilized egg has been implanted. Now, if you have severe bleeding, then you need to go see your doctor. That means severe bleeding with abdominal cramps, see your doctor. For the spotting, you can use the panty liners to help absorb the small blood that is coming out. Do not use tampons for any reason to reduce the risk of infections that can cause complication. Next are changes in your breast. You're going to notice that your breasts begin to feel tender and sore. Now, this is because hormones are increased, and these hormones are preparing your milk ducts for when the baby comes, and so obviously that will cause tenderness when you touch your breast. Another thing you might notice during this time is constipation. Now, we know that during this trimester, the first trimester, progesterone is on the rise. Progesterone generally reduces muscle contraction, which means that it will reduce intestinal movement, causing constipation. And also at this time, you're also taking iron tablets, which can have the side effects of constipation. Some women might have vaginal discharge that is thin and is milky white in color. Now, for this, you just have to use panty liners. You don't need to do anything else. Please and please avoid tampons. If you notice that the vaginal discharge is green, it smells bad, and your vagina starts to itch, you need to see your doctor immediately. Next is fatigue. Obviously, you're going to feel fatigue. An entire human being is growing within you. Your body is working extra hard to keep this human being alive. So you're going to feel fatigue. Do not be hard on yourself. Take naps, rest when you need to rest, and continue to maintain a good diet and lifestyle. Now, another thing we're going to notice in this trimester is the food cravings or aversions. Now, you're going to start craving foods that probably you didn't even like before, and then you're going to start avoiding foods that you probably used to like before. So certain smells might not be favorable for you. They might be disgusting for you, and then you tend to avoid certain foods due to that. 60% of pregnant women actually have cravings. It's fine for you to give into your cravings, but make sure to maintain a healthy diet while you're pregnant. Now, one thing you should look out for is something we call pica. Pica is actually when you begin to crave things that are not food, like clay, dirt, wood, detergent. If you begin to have those cravings, you need to see your doctor immediately. It could be a sign of anemia. Then you could also have heartburn during this first trimester. This is because, again, progesterone is on the rise. Progesterone reduces muscle contraction, which means that the muscles of your esophagus that would usually maintain the sphincters closed to prevent acid reflux is now not contracting as it should. So that means that acid reflux will be increased, and that can cause heartburn for you. Obviously, you're going to experience mood swings. Your hormones are all over the place, so you're going to experience sadness and happiness. It's a roller coaster of emotions. Try to be kind and gracious to yourself. Then, morning sickness, something that we all like to talk about. 85% of pregnant women experience morning sickness, mostly characterized by nausea and vomiting. Now, morning sickness can appear at any point in your day, not necessarily in the morning. It's called morning sickness because most people have more vomiting and nausea in the morning when they get out of bed. So, morning sickness will happen. For this, you want to try to eat small quantities, take enough water, do not lay down after eating, and eat bland foods like crackers, some kind of cheese. They'll help you with your nausea. And then weight gain. You're going to add weight. Now, generally within the first trimester, you're going to add 3 to 6 pounds because the baby is growing inside you. Although in this trimester, your baby is not that big. So try not to overdo it. 3 to 6 pounds is what you are expected to add to your weight during this trimester. Now, what will happen with your baby during the first trimester? In this trimester, the fertilized egg finally transforms into a fetus. Now, something very important happens, which is organ development. So your baby is now developing the brain, which is why our folic acid that we mentioned from the last video is very important. The heart is also being formed. Digestive systems are being formed. Arms and legs and different parts of the body are being formed. So this is a very critical time in your baby's development. Also, by 6 weeks, you begin to hear the heartbeat of your baby through an ultrasound. By the 10th week, your baby begins to urinate inside you. And they also begin to have genitals, but they're too small for you to know the sex of your baby at this time. But they also tend to have facial features. So eyes are popping out, nose and mouth. Your baby is actually being formed. This is the most important part of pregnancy. This is the formation period. And that's why you need to be very careful during this phase of your pregnancy. What will your doctors want to do during this phase? They want to do all the tests possible. They want to take a complete medical history. So they're going to be asking you a lot of questions. Please be honest and give them correct and truthful answers. They're also going to do blood tests, complete blood work. They're going to do blood type. They're going to test for sexually transmitted infections, different viruses. Urine tests will be done. An intravaginal ultrasound will be done to see how your baby is developing. A pregnancy test will actually be done at the beginning to confirm that you're pregnant. A pap smear will be done. All of this is going to be done to ensure that you are in a good state of health and that your baby is developing properly. So not be scared when your doctor does a thorough physical examination from head to toe. It's part of the process. This is what you're going to see in your first trimester. Make sure to be careful during the first trimester. Avoid anything that can cause trauma. Avoid anything that can increase your chances of having infections that could lead to a miscarriage or a spontaneous abortion. This is a time for you as a woman to just take time and enjoy the beauty of pregnancy. You can keep that information to yourself until you're ready to decide. Make sure you're paying attention to all the changes in your body, and if something doesn't feel good, get your doctor on the phone immediately. So this is what you should expect in your first trimester, and I hope that this video and the content is educative enough for you and that you're willing to share this video with other people. So go ahead and share the video. Thumbs up if you like the video and want to see more series on pregnancy. Do not forget to leave your question or your comment in the comment section, and of course I'll get back to you. And most importantly, subscribe to this channel, put on your notifications so that you get notified for every time I post a video. I'll see you in the next one. Bye bye.